everybody! In this video, we're going to cover 4 things. What ADHD stands for, what ADHD means, what ADHD looks like as well as common ADHD symptoms, and how to get your child tested for ADHD. For those who don't even know, ADHD stands for Attention Deficit Hyperactivity Disorder, which is commonly a misleading name because you don't have to be hyperactive to have it, and people with ADHD don't have attention deficit, just a difficulty regulating their focus. What does it mean? ADHD is a medical condition, a neurodevelopmental disorder. It is not a myth or a made-up excuse by parents of naughty kids. Persons with ADHD has differences in brain development and brain activity that affects their attention and self-control. There are 3 types of ADHD. Type 1 is the inattentive type, which people used to call ADD. Are children who are not overly active, have a hard time keeping their mind focused on one thing, and may get bored with a task after a few minutes. They are not disruptive inside the classroom or other activities, so the symptoms are harder to notice. Type 2, the hyperactive impulsive type, are children who show both hyperactive and impulsive behavior. Hyperactive behaviors can be children who always seems to be in motion, can sit still, may dash around, and talk excessively. Impulsive behavior can be children who seem unable to think before they act, blurt out answers to questions or inappropriate comments, and running to the streets without looking. Their impulsivity may make it difficult for them to wait for things they want or take their turn in games. They may grab a toy from another kid and hit others when they upset. They often have difficulty in keeping friends. However, children with type 2 ADHD may be hyperactive and impulsive, but may be able to pay attention for the most part. Type 3, the most common, is a combination of both types. Children with the combined type of ADHD show both categories of symptoms, which means it would be inattentive, hyperactive, and impulsive. So, how can you tell if your child has ADHD? To recap, some common symptoms are constant motion, easily sidetracked or distracted, trouble playing quietly, talking excessively, interrupting and intruding others, not finishing tasks, screaming and fidgeting, acting impulsively, and frequently forgetful. The next video will give you more information about ADHD.
Adrian, how are you?
Good.
How you doing? Give me 5.
School is becoming a struggle for first grader Adrian, who is easily distracted.
He's really active. He doesn't stay still.
You get lots of homework, Adrian?
Yes,
Yeah? How many pages?
15.
He's unable to complete the homework.
He is, and he doesn't stay still. He just gets distracted easily.
Pediatrician Blanca Fresno of Children's Physician Medical Group says children who have Attention Deficit Hyperactivity Disorder or ADHD are more likely to have learning difficulties but can succeed in school with the right support and treatment.
ADHD is a condition that affects the child in such a way that he or she is not able to control their behavior. It affects them in their everyday life. It affects them in their school performance and in their relationship. When the symptoms start affecting all the areas and things become out of control, pretty much you need to seek an evaluation.
We're going to check his vision and his hearing, and I'm going to give you some questionnaires for you to fill out. And the teacher needs to fill those out as well.
We test them for their vision and their hearing, and then we provide the family with a questionnaire. These are standardized questionnaires, and they are supposed to be answered by the parents and by the teachers. And when they come back in follow-up, we score these questionnaires, and those scores give us the risk for the patient.
A detailed family history is important because often there is a close relative with the disorder.
ADHD is seen in the family. Often we find out that it's in the father or a cousin or an uncle, sometimes in the mother.
If we decide that Adrian does have ADHD, what would be the process?
There are 3 different ways to approach treatment, through the school, through counseling, and through medical treatment. These medications have been out in use for so long. We do know that the outcome in children who use medications is better than those children that don't use medication.
Dr. Fresno likes to show parents this before and after example of how medication improved a young child focus on his schoolwork.
You can see how focused the work is here and how chaotic is there.
Dr. Fresno says it's important for both parents and children to learn ways to cope with ADHD.
Empowering these children with knowledge, giving them enough counseling to find out that there's absolutely nothing wrong with them. That's simply how they are and how they live in the world. And giving them the right guidance to succeed prevents so much of the complications of low self-esteem.
For more information on ADHD and other children's health topic, call 877-276-4543 or visit cpmgsandiego.com.